Without the Kraft program, we really don't have a way to develop the leadership skills for our future leaders. Our patients, without us there, might not get health care or might wait until they have an emergency and end up in the emergency room. We had a gentleman come in who had clearly not been taking his medications for years because he couldn't afford them. And when we told him that we could help him with the cost of his medications, he broke into tears and said that he had 5 children and that he was choosing to buy food for them instead of buying his own medications, and that he knew that that would probably cost him his life, but that was a choice he needed to make.
The fellowship has given me a sense of the broader social and political and economic context in which our patients live, but also in which healthcare is delivered. I think it's given me better understanding of the challenges that not only we as providers, but our patients have, and how difficult it can be when there's so much stacked up against you. It's made me a more empathetic caregiver, and to the extent that that, on the ground level, impacts the patient's experience, I think that's one of the most valuable aspects of the Kraft Center.
I'm doing the fellowship program, and as Kraft fellows and as Kraft practitioners, we've been able to learn about the political side of the national community health center movement. As a clinician, I'm seeing patients at a much brisker clip. I have about 500 patients that I've gotten to know over the last 2 years. I feel more confident in my decisions. My plan is to stay in community health.
This experience in the Kraft program has really empowered me, and to be able to look at our patient needs from a different perspective. The leaders in community health and in healthcare that have come and spoken with us and shared their life lessons and their successes and failures is priceless. Supporting this program is really supporting the people on the ground doing the work. Just a little bit of support can get a lot done.
We're in a time when we have a primary care shortage. We have few physicians to take care of patients and even fewer to take care of patients in community health centers. It's important to cultivate and nurture the interests that people have coming out of medical school, to say to them that there's resources for you to become better physician leaders, and things like the Kraft program are just that. When you train physicians to work in underserved communities, you certainly can increase health outcomes in those communities. And then when you do that, you decrease disease, and then you increase health status, and you make patients who want to have education a priority and jobs a priority, so you increase the workforce and you start to reduce all of those social determinants that we've learned about.
I became interested in the Kraft Center specifically to learn about policy and also an opportunity for innovation and to help patients in a greater, broader way. It makes me feel honored to be a part of it. For all of us who've been doing work with our community health centers, this impacts real change. You see people who've been patients and they're now leaders and they're now students. And if people invest in this program, they're investing in our future.